Throughout my career in practicing medicine, I have been fascinated by the importance of the encounter between patient and healthcare professional. As a result, my wife, Dr. Federica Raya, and I developed the concept of relational medicine, the intentional, mindful interaction between patient and health professional. The major focus of this concept is a creation of a trustful, empathic encounter that enables the patient to own their healthcare decisions.
What is new in our research model is the participation of patients, doctors, and researchers together in the research team. We videotape the routine medical encounters, and then with the patients and doctors as co-researchers together with us, we look at the video, sharing the reflection of what it means for each of the participants, what we actually seeing. From this emerged a different understanding of what the encounter is about.
10 years ago, I treated 2 heart transplant patients, Mrs. Candice Moose and Mr. Robert Milo, at Columbia University Medical Center. In the spring of 2011, I interviewed Candice, Robert, and their spouses about their heart transplant experiences and their perception of the relational medicine approach used in their care. These interviews inspired the writing of 2 commissioned plays based on the novel concept of emotion theater created by Wanda Monaco. The plays were then performed in the summer of 2011 at Playwrights Horizons in New York. The process leading to that performance began when the playwrights met the patients and the Relational Medicine Foundation team at Nash Studios in New York City.
Thank you all for coming. This is a moment when the playwrights, who are new to our group, are going to be able to understand and ask questions and talk a little bit about what we're doing, because now we're moving towards the writing of the plays. All right, well, Craig.
Hi, everybody.
Hi.
It's very meaningful to me to be here. I have several points of intersection with the work that I garner relational medicine touches on. I would not be here if it weren't important to me to share with an audience the nature of this experience, which flies in the face of so much of what we know is true in medicine now.
Your strength, Candice and Jim, thanks for being here. I would just ask you, can you share just how things started?
I remember it was a Friday morning, August 17th, 2001. As I was sitting there for lunch, I noticed that my heart was beating faster, more forcefully, and more irregularly than it ever had before. So they scheduled me for an electrophysiology study. And I will never forget this. The doctor had just returned apparently from a trip to Israel, and he talked the whole time to the staff, not to me, about the trip to Israel, and was regaling the staff, and it was like I wasn't there. It was like I was a piece of meat on the table. And you have to kind of gather that at this point I'm starting to get scared.
And you got scared because you felt that something was really wrong.
Really wrong.
Really wrong.
Really wrong, and that the people taking care of me didn't care about me.
There was a devastating experience for Robert and I at the hospital. He was there 3 months, and I was living at the hospital, and just being curious of how long it would take to get a heart for him. And one of the surgeons in the hospital, a prominent surgeon, went to the window and he said, come over here, I want you to see something.
Can I ask you a question?
I'll come back.
It won't take long.
You're better off speaking with this physician in the morning.
Wait. I just wanted to ask a doctor in person, someone who can tell me honestly, how long do you think he's going to be on the wait list for a heart transplant?
Come here. You see all those people walking along Broadway?
Yes.
Which one of them would you like me to shoot so he can get a new heart?
Felt like my doctor was punching me in the stomach. You know, to think that we were so callous that we would want someone to die. From the time I never went to doctors, and I always felt there was a reason because I didn't want the encounter. I felt they were cold, and it was, you know, their Corvette sitting in a lot, etc. And I also felt they were businessmen, you know.
The doctors at the previous hospitals were either frightened of me, exceedingly frightened of me, don't die on my watch, whatever you do, don't die on my watch, or they were casual. And that was the attitude. No investment in me. Don't spend any more than 2 seconds at my bedside because Lord knows if you're gonna die, we don't want this on our record.
They will tell us when you can go, won't they?
They told us.
Was that it?
Look, they're just going to get...
Help me! Can you? Can somebody please come? She's fainted! Nurse!
I had coded 3 times, so I was afraid that I was going to die without anybody medically knowing what was really wrong with me or caring. And then I got to Columbia, and Dr. Deng was waiting in the room in CCU. I remember so poignantly that this person cared not only about me, but that he cared about my husband.
You got to Columbia and you felt this sense of confidence among all the physicians, of access to the medical staff, and with her main cardiologist, as she says, a real sense of caring.
The caring way in which I could see him talking to my husband was just, I can't tell you how much I appreciated that. Because Jim didn't have anybody caring for him. He was caring for everybody else in the family, who were all falling apart. And then Dr. Deng walked over to my bedside, and he said, I want you to squeeze my hands. It was a momentary sense that whether I lived or died, that I was loved, I was safe, and I was cared for.
When you walked in the room, we kind of had to size you up because you wore the white coat. And we weren't sure whether the white coats liked us at the time.
You were the man that made me realize that whatever we did was going to be right for us. And you were very positive about making our own decision and not worrying about what anyone else felt in the hospital.
Everything had a purpose because now I had faith that I had a doctor who was going to see me through this. And that meant the world to us.